My presentation tries to apply some of the analysis and the pathways thinking into the context of implementation, which is slightly different than pure research. And the outline is that I'll share a little bit about the Sahara Program and then the study design that we have and what results we're finding, which are preliminary, and what the implications of those might be. I think many in this room know about the Sahara Program since we are in either year 4 or year 9, depending how you count. But the yellow areas are all the communities which we cover, which clearly span across most of the country, 42 of the 77 districts of Nepal, with a target of reaching nearly 2 million women and children, primarily in the 1,000-day window. Although we cover a large geographic area in the country, it's important to note that the interventions vary slightly. All of the communities within we are working do receive a core package of interventions. Those interventions are primarily social behavior change interventions, spanning health, family planning, WASH, encouragement for agricultural diversity and production, GESI, and so on. But our agricultural specific interventions are taking place in a subset, approximately 45% of the communities within which we work, which were classified based on a multi-sectoral profiling done by the government of Nepal pre-Sahara 1, and labeled as disadvantaged communities because of the degree of remoteness, the degree of food insecurity, and other factors. Those communities receive additional inputs, including the homestead food production package around gardening and poultry production, but they also receive more intensive SPCC, WASH, and gender and social inclusion interventions. That is a very fast way to summarize an extremely complex program, but I'll jump forward to the survey that we are doing, and I can answer programmatic questions if there are any during the Q&A. We conduct a cross-sectional monitoring survey each year. We have taken all of the districts within which we work and randomly sampled districts, municipalities, wards, and households. We have a sample of around 3,650 households each year, which includes a household head and a mother with a child 0 to 5 years of age. This data collection is done by New Era, and all of our surveys follow the norms of the Nepal Health Research Council ethics. Data collection is done in the rainy season each year, and we return to the same clusters to avoid all sorts of introduction of bias. So the research question that we have is whether there is any relationship between exposure to a program and dietary diversity for mothers and children, the main horizontal pathway that you see in the diagram. This is a main program outcome that we are hoping for. We're also curious about different pathways through which that impact might be achieved. It might be that there's improvement in chicken ownership because of our promotion of egg consumption, and that would translate into egg consumption and improve dietary diversity. Or this pathway might not be the one that's happening. It might break down at some point. We're curious about chicken ownership being the first mediator, leading to a second mediator of egg consumption and/or household food security. Before I jump into the results in which we ran these models, I just want to explain some of the measurement challenges. As I mentioned, we have a lot of social and behavior change activities happening in the community. These vary from interpersonal communication, which are primarily home visits conducted by Sahara-hired field supervisors and community nutrition volunteers. But we also have community events, support of the FCHV, the Female Community Health Volunteers cadre of health workers in Nepal. They run monthly mothers group meetings, which we provide technical support to, and add in food demonstrations and all sorts of other WASH events. And then we also have mass media, a radio program known as Banchanama, or What Mother Says, has been evolving over time. And the way we're able to measure this is whether there has been exposure to these specific intervention components or whether there has been any exposure overall, in which we've created a binary variable to assess that. Our outcomes are using the standard ways of calculating dietary diversity for women and children following global standardized norms. This is a continuous variables. And for mediators, we can look at food security using the Household Food Insecurity Access Scale, chicken ownership by whether they report that they actually are engaged in poultry production, and egg consumption using a 24-hour dietary recall. What you can see here is that as of 2018, which was 2 years into the interventions happening in these areas, 60% had been exposed to at least one intervention component with variation by type of intervention that exposure had happened to. For the outcomes, what you can see is that we have about half of the population, slightly less for mothers than for children, who are meeting the standards for minimum dietary diversity. And we have a mean of about 4 out of 10 food groups and 3 out of 7 food groups for children being consumed. While dietary diversity is quite poor, we have reached about 70% of the households who are food secure. And you can see the other confounding factors. These are some of them that we are listing. We know that there are many confounding factors. You can't see it, so I'll tell you them. Maternal age, child age, rural-urban residency, mountains, hills versus Terai, education status, etc. And of course, we need to adjust for clustering in the models. So the first step that we did was we tried to see if there were any associations between the specific SPC components or the overall SPC package and outcomes of interest. You can see here that they're all highly statistically significant, but with relatively small beta coefficients, meaning the ability to find an association between an SPC intervention and program output is there, but the question is to what degree. I also wanted to look at this differently in our intensive areas to see if there was any variation. And what you can see is that other than for the top row where we've had this null association with maternal dietary diversity, for the rest of them, the magnitude of the association is stronger. And this is consistent with other analyses that we're doing, which also shows that the frequency of exposure matters for outcome. So this is consistent with other dose response publications in the literature, where the more platforms that you're exposed to that reinforce a consistent ideal behavior, the more likely you are to embrace that behavior. So this is great for looking at it descriptive or in a regression model. The challenge becomes when you try to look at something that complicated into a more complicated model like the pathways model that we've explained. So this is the same pathway that you saw at the beginning where I explained the research question. And I hope that the slide is clear enough. The main pathway is trying to look at the association between exposure to any Sahara intervention and maternal and child dietary outcomes. And this particular slide, the coefficients you see and the p-values are relative to maternal dietary diversity. And these are not standardized coefficients, so it's 0.36 of the 10 food groups in the dietary diversity score. And what you can see is that we also do find a pathway from exposure to these SPC components to chicken ownership through egg consumption and dietary diversity outcomes. So in this case, both the direct and the indirect pathway seem to be operational. But we're also interested for child dietary diversity. And what you will see in child dietary diversity versus maternal is that the direct pathway is a slightly smaller magnitude, whereas the indirect is a slightly higher magnitude, which requires further investigation as to why. But following along as I did with the regression modeling, if we want to look at the pathways and we want to understand what is happening in an area of the country or communities of the country that get a core package versus a core plus package, meaning the agricultural package, what you can see here is that the magnitude of both the direct association and the indirect association go up dramatically. And this is even withholding the fact that this is a smaller sample size and therefore the power to do basically in a pathways analysis, multiple regressions in one model is further restricted. Despite this, we do find that the magnitude of association is stronger in our areas that are receiving the agricultural components of the program. And the same holds true for child diets. And what I should say about the pathways analysis also that varies from the standard regression modeling is that in the pathways analysis, these are standardized coefficients. So when you see 0.5, you're talking about any exposure to Sahara increasing the likelihood of having an additional dietary diversity, of having half an additional dietary food group. And as we saw earlier with the standard regressions, more and more exposure means more and more. So we still have to play with this to try to understand in the pathways model what additional exposure to different interventions, how that would play out in the indirect pathway. So this is for child egg consumption and for chicken ownership as a potential indirect pathway that explains why the program can influence dietary diversity. And the other one that we're interested in is food security. And you can see here that the pathway, it's not clear if the pathway breaks down or not between chicken ownership and food security. If you look purely at the p-value, it does not meet this arbitrary cutoff of p 0.05. However, we think that this might be due to power reasons and also to how we are measuring food security at this point in the model, which is a strict cutoff, and almost 75% of our households have food security. The same is true for child diets, and since you have now seen 4 of these slides, I think we won't go into it any further. I'd rather jump to the next steps. So the next steps is that this is a really preliminary analysis, and some of the challenges with the model, I don't know if you picked up on the fact that the indirect pathway had a higher coefficient than the direct pathway, which cannot be possible. This is due to the fact that egg consumption and child dietary diversity are collinear, that we're measuring some variables in a binary fashion, some continuous, and many other boring research details that I will spare you from. But much of the model cleaning still needs to be done, and we also need to qualitatively explore why these pathways are occurring, and it seems to be a stronger pathway in the EHFP areas versus not. I also want to recall to everyone that I mentioned these are cross-sectional monitoring data sets. This is not a causal data set, so we'd like to rerun these models once we have our evaluation data, which has a counterfactual within the data set and would give us more confidence to believe the results that so far are encouraging, but we're cautiously optimistic about. We also know that these pathways do vary by other factors. There's been mention of gender and women's empowerment as well as other social inequities. And the reality is that the way the pathway plays out in one household or one community might be different than in another household or another community. This requires looking at moderated mediation, which basically puts the entire pathway under a test to explore whether this other factor causes variation in the pathway's results. And we also need further experimental studies. I liked what Dr. Kiran said this morning, that with MSNP, we're not just looking at ag nutrition. We have to remember that our households and our communities, while we in this room are talking about ag nutrition pathways, WASH, family planning, health, many other factors are happening at the same time in the same space. And for a program like Sahara, we are trying to trigger multiple different pathways, of which agriculture is an important component, but it's important and insufficient if we don't address the other pathways. And so in summary, I think what we can see is that Sahara 2 exposure after 2 years of intervention is quite high. More than half of households had received at least one type of exposure. And this has increased. I did not show the trends over time, but it has increased from around 25% to half, and in our latest annual survey, more than 80% of households have received some type of exposure. Maternal and child dietary diversity remains poor, but we now have, as of 2018, about half of mothers and children who do meet standards for minimum dietary diversity. This is consistent with other indicators in which we're finding that all the complementary feeding indicators, introduction of foods at the right times, minimum acceptable diet, these things are changing rapidly and reminds us all that context is not static, but changing. It also is a good and important reminder that social and behavior change is a way of going about doing some of the necessary work for the findings that other studies are raising alarm bells about aflatoxins or junk food, et cetera. But the question is how far we can expect SBC to actually work and what other factors there might be that restrict the ability of SBC to be a game changer, markets, poverty, et cetera. And so I think what you saw is that there are direct pathways between exposure and dietary diversity, and that you can expect kind of a half food group change over time if this were to play out into an evaluation data set. And the indirect pathways also show that exposure to SBC, which is promoting dietary diversity and heavily promoting egg consumption, is changing household ownership of chickens, and in turn egg consumption, and in turn dietary diversity. These pathways, from a preliminary analysis, seem to be stronger in EHFP households, which further proves the importance of investing in agriculture as a means for nutrition and health. As you can imagine, implementing in more than half of the country of Nepal is not a small endeavor, so I'd like to close by thanking the government of Nepal, the National Planning Commission, and all the ministries who work with us, our USAID colleagues, both in Nepal and Washington, who are tremendously supportive of our efforts, and all of the different partners across the country who actually implement the SBC behaviors which we are trying to measure. Thank you.